Please stand by. We are ready to begin. Good day and welcome to the Promoting Resiliency in At-Risk Youth, Promising Practices for Encouraging Healthy Relationships conference call. Today's conference is being recorded. At this time, I'd like to turn the conference over to Ms. Andrea Strahan. Please go ahead, ma'am.
Thank you so much, Ruth, and hello, everyone. I'd like to welcome you to the National Resource Center for Healthy Marriage and Families webinar, entitled Promoting Resiliency in At-Risk Youth, Promising Practices for Encouraging Healthy Relationships via Integration of Relationship Education Services into Services for Youth. My name is Andrea Strahan, and I am part of the Resource Center team. I'd like to thank everyone for joining us today. Before we get started with the presentations, there are a few housekeeping items I'd like to go over. Just to let everyone know, we will be taking questions at the end of the presentation, but we encourage you to submit your questions that you have throughout the duration of the webinar. To do this, find the question and answer pane designated by the letters Q and A on the top left portion of your screen. You can click on that portion of the menu bar to open the pane, or you can open the pane and drag it off the menu bar to display as a standalone box. Type your question into the top box and then click the Ask button. You will receive an automatic reply thanking you for your question. This frees up your question and answer pane, which allows you to ask another question if you choose. This presentation, a transcript, and a frequently asked questions document will be posted to our website, healthymarriageandfamilies.org, within about 10 business days. If at any time you would like to view the presentation full screen, please press the F5 button. You can hit the Escape button or the F5 button again to return to normal view. Our speakers today will be Robin Senezal, Project Director, National Resource Center for Healthy Marriage and Families, Head Futurist Training and Technical Assistance with the National Resource Center for Healthy Marriage and Families, Deborah Gilmore, Family Safety Expert with the National Resource Center for Healthy Marriage and Families, John Barner, Training and Technical Assistance with the National Resource Center for Healthy Marriage and Families, and Gilbert Chavez, Program Specialist with the Child Support Family Initiative with the Texas Office of the Attorney General. So with that, I will go ahead and turn the call over to Robin Senezal, Project Director here at the National Resource Center for Healthy Marriage and Families. Robin?
Thanks, Andrea, and welcome everyone. Today's webinar goals and objectives are for us to describe promising practices for integrating healthy marriage and relationship education into services that promote youth resiliency, also to share strategies and examples of how to develop a plan of action for integrating these skills, and to describe how the National Resource Center can assist you with that integration process. The National Resource Center for Healthy Marriage and Families, our mission is connecting healthy marriage education skills and safety net services as an integrated approach to strengthening families. The concept is to bring together these healthy marriage education skills like communication, conflict resolution, and critical skills like parenting and financial literacy, to bring them together with the safety net service providers that we serve. So when you think about safety net service providers, we're talking about all of the services that come into play to help families who are at risk, whether that be child welfare, child support, domestic violence, education, TANF. All of those different services are the services that provide the safety net that support families in their efforts to maintain self-sufficiency, regain self-sufficiency, or just to sustain themselves. When you think about healthy marriage education skills, as I mentioned, these skills are communication skills, conflict resolution skills, interpersonal skills that transfer into the workplace and help families become more self-sufficient, as well as these critical skills I mentioned, financial literacy and parenting. These are skills that are very helpful in helping families to increase their coping mechanisms to deal with the major family stressors, which are often finances and parenting. So what does the Resource Center offer? We offer research that supports and promotes the integration of healthy marriage education skills. We also offer resources, tips, and tools that you can use for your colleagues or share with the families that you serve, and training and technical assistance to support stakeholders like you as you work to implement integration strategies. The Resource Center has a lot to offer, and I will come back to you later in today's program and talk more specifically about some of the resources that are available after you hear from our great speakers. So with that, I will turn it over to Ted.
Thank you, Robin, and good afternoon, everyone. Thank you for joining us here today. I'd like to highlight a few, start off with, there we go, a few reasons why promotion of marriage and relationship education among youth is important, particularly in facilitating youth resiliency. Research clearly has shown that the skills that can be learned from healthy marriage and relationship education can be particularly relevant and appropriate for adolescents who are beginning to explore adolescent relationships, increasingly becoming more involved in dating relations. And this is part of figuring out who they are. Relationships is a part of their identity as adolescents and as future adults, healthy, productive citizens. So these skills that they learn translate into multiple contexts, whether it be peer relationships, parent-child relations, teacher relations, co-worker relations. Also, youth who are educated about healthy relationships are also more likely to have better relations with peers. For example, research has shown that they learn conflict management strategies that are effective, reduce the likelihood that they become involved in physical confrontation and conflict with others. It also has shown that parent-adolescent relationships actually become more positive as adolescents learn effective communication strategies and ways to handle disagreements. So their functioning becomes better, and in the long run, we hope that through these educational services that it will reduce the likelihood for need for other support services. There's still lots of research that's needed to understand the efficacy of relationship education on youth, but what currently exists is very promising in terms of immediate short-term impacts on changes in knowledge, attitudes, and behaviors. This type of education is very accurate and timely information for adolescents in terms of developmentally where they are, but it also can decrease the occurrence of negative youth behaviors. For example, predominant percentage of first-time sexual experiences among adolescents are reported to be within the context of a romantic relationship. Upwards of 85% of teens who report having sex for the first time report that it's with someone that they're romantically involved with. And many of them are having sex within the first 3 months of their relationship, or what they believe to be a boyfriend or girlfriend relationship. So by educating youth on the process of developing relationships, the time it takes to develop relationships, we can potentially slow those behaviors down and reduce the likelihood that they engage in those type of negative behaviors. We also see a high rate of teen dating violence, intimate partner violence among adolescents, and learning those signs of what healthy versus unhealthy relations are is very important, as many adolescents aren't aware of some of those signs of unhealthy relationships because for many they're surrounded by unhealthy relationships, and that's kind of the norm maybe in terms of how their adult models communicate and manage conflict. So relationship education can help deter some of those negative behaviors. And relationship education has also been found to be very relevant for diverse youth. It's been found to be effective for socioeconomically diverse youth, racially diverse youth, ethnically diverse youth. So it cuts across the board in terms of its potential impact on adolescents and their current and future relationships. Now, with the center, one of the things we're working with professional stakeholders like yourselves is helping you identify kind of where are you with regards to how you integrate relationship education, if you're currently integrating, and provide you a service to help move you towards, ideally, full integration. And I'll describe what these each are and give you some examples here. But in general, basic engagement of healthy marriage and relationship education with youth is providing them the literature, sharing those resources, putting posters and brochures and pamphlets out there to make it accessible to youth as well as their caregivers. That level 2 involves partnerships that bring expertise to your agency, to the services that you provide. You might not have the capacity, the staff, the resources to provide the relationship education yourself, but you might know of community partners that can help you with that. And full integration really is a movement towards training your staff to offer relationship education as one of the services that you offer, and finding ways to integrate it into what you currently provide. So some examples, for example, here in terms of what integration looks like at these different levels. Level 1, for example, materials can be distributed and displayed for youth at school through health classes or made available at the nurse's office or in the guidance counselor's office. Through after-school programs in the community, such as recreation centers. Detention centers could even provide some of these resources, as well as faith-based organizations. They could be shared during face-to-face meeting with providers or placed as handouts in waiting rooms of community health and mental health centers, teen centers, for example. These could be posters, handouts, pamphlets on what healthy relationships look like, what intimate partner violence looks like, and what these skills involve. Level 2 would involve, reaching out, engaging with community-based organizations that may already be offering healthy marriage education or conducting teen groups. For example, the Cooperative Extension System in many states who offer 4-H programming as well as family consumer science programming. Many times those educators are trained and capable of providing relationship education, as well as healthy marriage grantees, and school systems may be great partners to consider as well. Formal, informal referrals would fall under level 2. Maybe you're not at the capacity to offer it yet, but you know of services available in the community that you can refer your teens to attend those workshops and programs. And partners may even be willing to come on site and offer those workshops if available space and time works out. Level 3 is where you find ways to supplement existing, for example, supplement existing health classes or sex education programs with relationship skills to reinforce the connection between sexuality and relationships. Many times the sex education curriculum programs really do a great job of helping reinforce to teens the consequences of having sex and the emotional aspects of sex and the impact it has, but really many curricula fail to cover the context in which sex happens and helping teens understand everything else happening in the relationship, and is it really a healthy relationship. You might develop or complement local teen groups with a focus on healthy relationships. Training professionals and volunteers can also utilize appropriate curriculum to develop programs or integrate relationship education into the services that you provide at community centers as well as other mental and health clinics or centers. So depending on your resources and your capacity, you might find yourself at one of these 3 levels. What we hope is through this webinar you'll hear an example of what integration can look like in a particular state, as well as some of the challenges and lessons learned in integrating relationship education to your services. And so with that, I'm going to first transition this over to Deborah Gilmore, who's going to talk about factoring in family safety at the different levels of integration as you move forward.
Thanks, Ted, and we'll talk about the levels of integration in just a minute, but you are probably, if you're listening to this call and you're what we would consider a stakeholder, you're probably very, very familiar already with these numbers that are up on your screen now. The high numbers of children living in poverty in the U.S., those victims of intimate partner violence, and by the way, these are not crime statistics, this is a survey that's going to be an ongoing survey by the Centers for Disease Control. which is producing higher numbers than you might see in crime statistics for intimate partner violence. And then back to administrative data, so child welfare numbers on the numbers of children who are referred to Child Protective Services annually. And those of you in the field absolutely know that most of those are for child neglect and not child abuse. You also, I'm sure, know how these are correlated all with each other, and all three also correlate to negative health and well-being outcomes. And part of why these numbers are so high is because they encompass a wide variety of problems and concerns. It's not just the darkness that, you know, the real physical abuse and bruising and broken bones and things that we see and that are often used to highlight these types of issues. It's really a wide variety of concerns, and some of those are situational. Some of those might be triggered by a particular event. Some of them are chronic. Some involve substance abuse, mental illness, so they are more chronic issues. And of course, some of those are immediately visible and some are not. To me, these numbers do two things. They not only show the enormous risk of working with a family who's impacted by some type of violence or maltreatment, no matter what you're doing, but they also show, because poverty is the highest among these numbers, that not every family who is living in poverty is also impacted by family violence or neglect. And I think that's important to remember in terms of making sure that we continue to treat all folks and individuals as individuals. And this is really getting to the heart of the focus of this webinar, and that is youth and dating as opposed to marital relationships. If you're like me, you see a graph and the first thing you do is kind of gloss over and wait for someone else to tell you what this is, and so I will do that. And please know that if that's you, that's me too, so I don't blame you, but I thought a graph was the best way to kind of have a backdrop for what I'm going to talk about next, and that is how what happens to you as a child and what happens to you later all correlates with having or not having healthy relationships. This is from a study by Dr. Murray Strauss. If you're familiar with him, you know that he has been for literally decades, he's been one of the pioneers working on family violence. And has been, among other things, the principal investigator for a longitudinal study that studied university students and studied them across more than 30 countries, and so that's where the data that you're seeing comes from. His studies showed that the more a person experiences neglect as a child, the higher the likelihood that that person will commit violence against a dating partner. And this graph was specifically university students who were neglected as children and have now indicated that they're perpetrating violence against their dating partner, that they've done that within the last 12 months or last year. And so two things, again, there's two things from this particular slide. One is not only shown by his work, but it has been shown by multiple other studies, and that is that violence is much more prevalent in dating relationships than it is in marital ones. And so the women, hopefully it's large enough type that you can see it, the women in this study, just notice that the line is consistently higher than the men, and that is because the girls or women in this study were just as likely, if not more likely, than the boys to report being the perpetrator of violence. And again, that's been shown in not just this study, but multiple other studies, and that is different from adult relationships, in which there's mixed evidence of the extent to which women are perpetrators of intimate partner violence, and there's lots of reasons for that, which again goes back to what you're really talking about when you're talking about intimate partner violence and what it looks like. I think those were the things I wanted to highlight here, and let me move forward. This is really coming back to what Ted was talking about in those levels of integration. There's lots of ways that you can integrate talking about healthy relationships and that you can address family safety within that context. So these are just a couple of of ways that you can do that. That first level that Ted talked about, basic engagement, could simply mean handing out pamphlets on healthy relationships. It sometimes means that you are going for the negative and talking about signs of dating abuse. I always like to say that you should really show tips of what to do along with what not to do. I think it's the more concrete we can be about what good things can look like, the better, the more helpful that can be for people who are just looking. They already know that what they're doing is not, maybe not what they're supposed to be doing, but if they don't know how to change it, then that's not the most helpful information. And the final bullet here is the other piece I'm going to, and the very final bullet is really what I'm going to highlight as well. That is solution building with students and youth that you are working with, and that's really, I imagine that most of you on this call are probably mandated reporters, so you're already aware of having to do something at the intervention level, and that's really just talking about another way that you are responding based on level of risk. But healthy relationship education is really a prevention strategy, and integrating that within that response based on level of risk is a way that you can build solutions with the students and help them to actually come up with their own ways of providing healthy ways, either to enhance a relationship that they're in or to exit an unhealthy relationship. And with that, I'm going to turn it over to our special guest speaker, Gilbert Chavez, who's going to talk about, it's going to give you a very concrete example of how they've integrated healthy marriage and relationship education.
Thank you. First, before I get started, I really kind of want to send a warm thank you to the National Resource Center for Healthy Marriage and Families for inviting me to speak today in regards to a program which I'm very passionate about. It fits completely with the theme that we are discussing here today, and it's really nice to see that there is a coordinated effort to really get this information out to young people. My name is Gilbert Chavez. I am the program manager for a group in the Child Support Division in Texas called Family Initiatives. We do a multiple thing, but I manage a small group of 3 staff who really focus on youth and forming family outreach and education. So making sure that those young people and even young families who are trying to navigate their way into being what they see as a family can understand some of the legal issues in regards to parenting in the state of Texas, in the state of Texas specifically, but really hopefully to reach their aspirations of being responsible parents in the future. I really see what we do in the Family Initiatives section as, and specifically in what I do with youth and forming families, is kind of the prevention side of child support. You know, how can we help these young people decide when is going to be the best opportunity for them to be a parent with the most success of having good outcomes for their families. And I'm sure many of you on the phone call are very aware of some of the statistics in the state of Texas or even in the nation regarding out-of-wedlock births, marriage, divorce, and what we try to do is really try to provide information and resources to young families in the state of Texas to hopefully avoid negative situations or even negative outcomes in our child support process. So with that, I want to speak of one specific program that we have, and that is the P.A.P.A program. And P.A.P.A stands for Parenting and Paternity Awareness. It is a 14-session curriculum that we developed for middle school and high school students in the state of Texas. This is very much a child support curriculum, but at the same time realizing the importance of having a discussion about healthy relationships, the cost of raising children, child development, the prevention of family violence and dating violence, education about the child support process and the legal laws regarding becoming a parent in the state of Texas when they're not married, but also the responsibilities of being a parent. And so what we try to do is really kind of get in front of the issue This is information which is, immediately needed for teen parents, parents who are trying to navigate, the financial and the emotional needs of children, and how they may interact with the child support process. So that may serve as an immediate need, but we focus on making sure this information gets out into the general public and in the general high school population, so that everyone attending the high school will have an opportunity to think about what it means to have a healthy family, to talk about marriage, and to talk about the other things which P.A.P.A includes. To kind of go over why this program was developed by the Attorney General's office, all you really need to do is look at what are some of the statistics that we see. Nationwide, we see over 40% of all children born will be born to unmarried parents. And for the Child Support Division, that has a direct legal issue for those families, and that is establishing paternity. And so that is something that we want to make sure that young people and also the general public understand the processes for establishing paternity, but also the benefits of establishing paternity and the need for creating that legal connection with the father and the child. Because in the state of Texas, as all states, when unmarried parents have a child, the state only legally recognizes one legal parent, and for us to establish that legal connection to the father, they must first establish paternity. And so that's a direct need for P.A.P.A to go in and talk about what are some of those legal issues, how is this process completed, and why would couples need to consider establishing paternity when they have a child and they're not married. I do presentations all over the state of Texas, not only to young people, adolescents, and young adults, but also to professionals and paraprofessionals. And it's amazing to me. I've been doing this work since 2004. It's amazing to me how much misinformation there is in regards to the rights, responsibilities, and realities of parenting, and what those legal issues are. Our thought is if we can provide information before there is a significant need or before that major breakup between that family, maybe we can intervene in a way where both parents will still understand the responsibilities they have for raising that child, but also, better able to interact with the child support system and not feel that child support is happening to them, but they have some point to interact with the child support system and have realistic expectations of what we can do. So that's how it's connected to the child support system. More than anything, we would love just to prevent negative child support issues, which may include not getting in the child support system to begin with. Because if the couple, have a healthy marriage and have a two-parent household where they're raising that child, then maybe there is never a need for child support, and that's okay as well. So this very much serves as a child support outreach and education and a child support program, but it has other benefits, but it also had some challenges, and so I kind of want to talk about both of those, some of those lessons learned, but also some of the challenges that we've seen. The P.A.P.A curriculum has been around in one form or another since about 1995. There was a need and a request from school districts to the Child Support Division to go out and to provide information to their teen parents, to talk about child support, to talk about why there's a need to apply for our services, or the financial support that is provided through that child support and how we can get that set up. And so that's really the genesis of this program, and where it was really designed to kind of fill that gap for those teen parents. But as we moved forward, there are multiple classes in Texas high schools where they discuss parenting preparation, family consumer science, and the information that we were providing through the P.A.P.A curriculum at that time talked about, parenting and responsible parenting, so it really filled that need for those teachers. And so we formalized a curriculum in 2004 that was originally 10 sessions, and this very much goes to the lesson that we've learned in the process. But at that time, what we would do is we would mail a 3-ring binder with 300 plus pages of the curriculum to each school district, and with instructions of how to use it, who they should give it to, and how it might be used. Years later, when we were going back to see how it was being used, we still found some of the curriculums in its wrapper up on a shelf and not being used. And so at about that time is when I came on with the Child Support Division, but we really at that point took a look to see how do we make this curriculum really used by those high school teachers. And so what we did at that point is we did some revisions to include healthy relationships, child development, and some other components, and tied those components to the actual standards that were being taught in the classes, in the high school classes. So it may have been family consumer science or life skills or some other class, but we would tie each of our sessions of the curriculum to that specific classroom and say, okay, you could address these aspects of the curriculum through your class that they were teaching. And so that was beneficial. But it still needed that personal training with the teacher to really understand how it would be used with their students. So we required training. Beginning in 2005, we provided the curriculum free of charge to anybody who would want to attend a training. The training is 6 hours long. We would cover the major points of child support and establishing maternity. We would review the activities and run the activities with them so they'd have a better understanding of how the P.A.P.A curriculum would be used. And that was a great thing. We found that it was putting in a context where we provided the training, the teachers felt more comfortable with the child support information, the paternity information, but also could visualize how they could see P.A.P.A as a tool to complement the things that they were already teaching in their classroom. So that was the major piece of getting the P.A.P.A curriculum implemented. And then in 2007, legislation was accepted and passed that P.A.P.A would be taught in every health high school class in the state of Texas. And so where we were primarily going out to family and consumer science classes and community-based organizations to give them this curriculum and to discuss this curriculum, starting in 2007, every health class teacher in the state of Texas was immediately required to take our training and to implement the P.A.P.A curriculum within their health class. And so where we were scrounging up to get 2,000 educators a year through the P.A.P.A trainings, we were immediately bombarded with trying to train close to 5,000 teachers to implement the P.A.P.A curriculum in a single year. It was a big advancement in making sure that P.A.P.A was taught in high school health classes, but also it increased the students who would ever see the curriculum, because in primarily family consumer science classes or life skills training classes, they were primarily female. And so when it was advanced to the health classes, we also see that many more young men would also receive this curriculum as a part of their normal health classes. So that was a huge advancement in this curriculum. As far as the lessons learned, providing in-person trainings was a big part of the adoption of the curriculum by the teachers, so they better understood how to use the curriculum. One of the things in Texas high schools is to really make sure that people understand this is not a sex education curriculum. that really the P.A.P.A curriculum is something that is about the responsibilities of parenting and how do you sequence your life events so that you will be successful in the future, which includes going to school, graduating college, getting married, having a family. So talking about the success sequencing in a way that we're not really addressing sex education. So this absolutely could be seen as a complement to sex education, but was more about how do we create positive families in the future, their futures of parenting. So making sure that that was clearly understood. Of course, becoming a mandatory program within the high school health class was a major deal, but also being run out of the child support division, we were able to provide this training free to high schools without a charge, and that was a big issue as well. They didn't have to actually pay for this curriculum, and we would actually provide the training free of charge as well. So it was just an effort to make sure that they were being used within the high school health classes, and they clearly understood those messages which we were trying to present in the curriculum. P.A.P.A has been evaluated by the LBJ School of Public Affairs. I know that the National Resource Center has that evaluation available to anyone who might want to see that. You know, we spend less than $1 per student outreached in the state of Texas per year. We do revisions on the curriculum, especially with law changes, and try to provide the best curriculum we can to health teachers. And so we're always looking at how we make our information better for the students and digestible by them. And so it's created by public funds. We created the P.A.P.A curriculum with 4D funds, which is child support funds, and we do and often share it with other states. And so we work with and will work with other child support divisions or human services divisions in other states if they're interested in the P.A.P.A curriculum to look at how their laws might need to be adapted to the P.A.P.A curriculum, but this is something that we freely hand over to other states to look at how they might be able to use that. And as a quick pitch, if Hawaii's out there looking to adapt it, please give me a call. I would love to talk to you about how that might be done. The P.A.P.A is something that I'm very passionate about. I think that the information that we provide, including the responsibilities of parenting, but also understanding the warning signs of relationship violence is very important for our young people. This provides an opportunity for them to look at their aspirations of being a parent in the future. All I'd like to say is if you want more information about the P.A.P.A program, you can find out via our website, texasattorneygeneral.gov, and on the left-hand corner there is a P.A.P.A section which you can look at our materials. If you have any specific questions for me regarding our collaboration with other states, you can email me directly, and I also encourage you to ask any questions that you might have that we might be able to answer today. So I appreciate the opportunity to talk about the program, and I'll turn it back over to John.
Thank you so much, Gilbert. What I'll be reviewing today is just some of the lessons, challenges, and strategies for integration that were shared during the National Resource Center for Healthy Marriage and Families Peer-to-Peer Network Forum. And that was held in Washington, D.C. on July 18th and 19th of this year. Our purpose for convening the forum was really for federal, regional, state, tribal, and county safety net stakeholders like yourselves to share some of the challenges experienced and successful strategies employed to strengthen the integration of healthy marriage and relationship education and skills into their existing service provision. And like we've seen with the great example of the P.A.P.A program, there's a lot going on for successful integration. There's a lot of moving pieces, a lot of things to be aware of, but each and every one of those pieces holds a remarkable chance for success for the wider stakeholder audience and the clients that you serve. The first thing that I wanted to talk about is building effective partnerships. One major challenge that the attendees of the forum mentioned was maintaining effective communication both within their agencies and between other agencies. Communication between agencies, between levels of government, can be a huge challenge, but it is also key to creating successful integration. Success lies with establishing a type of network, whether formal or informal, that works for the needs of your agency and for your stakeholder group. Some of the things mentioned were just a weekly email update for things that were going on within the agency to staff members. Other people created a listserv on the internet where people from different agencies could contribute. One participant even mentioned just doing a quarterly newsletter. Something that simple really brought people together, sharing ideas, and established new partnerships that didn't exist before. Connecting with community organizations can be a huge asset that's also often untapped. Connecting with schools, after-school programs, community organizations, including faith-based organizations like the YMCA and YWCA, nonprofit organizations, schools, child care professionals in the community. They can provide resources, ideas, and connections that can make integration a success, including sharing some of the burden, as you see in the levels of integration that Robin and Ted talked about. Having someone to pass out flyers, maybe show a video in the waiting room, can really be the key component that gets the message out. And these last three bullets are really all about getting that message out, including families or individuals, especially teens, that can serve as partners if they've successfully gone through a program or can share a success story, can provide a valuable perspective. Several of the stakeholder participants at the forum mentioned that having families share information about a program or about a particular type of marriage and relationship education through word of mouth was a boon as far as recruiting other families and individuals. Agencies can also include these partners by placing them on advisory boards or including them in their strategic planning process. Teachers as well. Teachers can provide a wealth of feedback for the students in their classroom and the families that they come in contact with, and can also provide a valuable piece of outreach, both inside and outside of the classroom, that will allow you to engage others in the community and really shore up support. This type of information sharing can often make navigating a complex system of partner agencies, departments, other people, examples like universities and cooperative extension, as well as child welfare agencies, can really help that information get spread out and not so much lost in the shuffle. Information sharing strategies that some participants suggested, again, had a lot to do with incorporating technology whenever possible, so that people with busy schedules can still feel like they're in touch and in tune and making that connection with what is going on in their community. Making the connection across services is really important too. Utilizing what's going on in the education system, as we saw in Gilbert's example of the P.A.P.A program. When that program became mandatory, they had full force of the education system to really get the message out, and that was a massive recruitment tool as far as getting not only female participants but also male participants. Using systems like the child support system, is a great way to make a connection for healthy marriage and relationship education to a vital class of people that need that information to carry on. And then, of course, the child welfare system is also another valuable tool, and that speaks to Deborah's point about the developmental trajectory that we see in that when you're engaged and provide this information early enough, it can really make the difference for an entirely new generation of parents and couples. And then educating your supporters. When working with a large population, it's vital to have the support of community leaders and government officials. Our stakeholders suggested educating directors of agencies, state legislatures, the governor, the mayor, or other high-level officials in order to try to receive their support or make getting the support of those who they lead much easier. Putting a face to the cause can create that kind of connection and may lead to a very strong partnership. This may require some work, phone calls, face-to-face conversations, and will certainly require more time, but may be worth it in the support received. Crafting that kind of message, that powerful message that's going to get you the support, requires a lot of developing relationships with peers and partners who can personalize that message. I've spoken already about engaging family members and participants in crafting the message, but also using strong resources for families, talking to the public, and making it more of an our program or our initiative or our curriculum, very much like the P.A.P.A program, rather than our particular agency's program. It's something that belongs to the community. It's a community resource and a community service. Some effective strategies always present their own unique challenges, because incorporating healthy marriage and relationship education can often be difficult to do with an overburdened staff or in the midst of providing another menu of service. And so having a clear strategic plan that breaks down the steps was a highly valued strategy by our forum participants. Making decisions, utilizing your available partners, and coming up with a plan that directly corresponds to not only the circumstances within your community, but also what other partners may already be doing is a key component. Other stakeholders identify that recruiting and retaining participants can be difficult, and identified several strategies to overcome those challenges. They may be associated with creating activities or events that remove any preconceived stigma, focusing on the positive elements rather than trying to categorize a potentially violent or unhealthy relationship, by focusing on making things stronger, making families stronger. Providing program support that helps families to participate, such as transportation, child care, or a meal, can increase attendance and retention. And agencies may be able to talk to state officials about how participation in a program, or education people at the school board, how participation in a program might benefit families who are receiving some kind of assistance. Addressing special circumstances like safety, literacy, health and mental health issues, poverty level, homelessness, substance abuse, are some of the things that you may encounter while trying to launch an integration effort in your community. Some providers may need to direct participants to resources that take care of immediate or basic needs before attempting to enroll them into a program or point them to a particular curriculum. So keeping these special circumstances in mind is also a very valuable challenge, but can also lead to that community level of integration and success. Adapting for diverse populations, it's important to know your audience and know partners that can help with this. In aligning particular curricula with community needs, stakeholders identified finding an ambassador or a type of champion to serve as an intermediary between agencies and the diverse families that they serve. And then there's finding the right curriculum and facilitators. Several stakeholders at the forum identified finding skilled facilitators to be both a challenge, and then when those facilitators were found and trained, a valuable key to success of a program. People who are comfortable, committed, and passionate were some of the words that were used to describe facilitators. Some found that in a small community, staff had to be careful in choosing a facilitator because of the personal relationships and backgrounds that they may have had with participants, where others said that having somebody who put a personal touch on it, was able to tell and share stories from their lives, was a valuable recruitment and retention tool. For many agencies, facilitators and staff are spread throughout a state or region, and that can create several barriers. Budgets oftentimes don't allow for too much in the way of travel. To overcome these kind of obstacles, the stakeholders addressed some key practices. The first and foremost kept coming up during the forum was the use of technology, providing ongoing motivation for facilitators and participants, and offering training for special populations and groups. Those were all key components to getting facilitators motivated and ready to participate and recruit and retain participants. Before I turn it over to Robin, I have two survey questions. These questions are very important for us. They help us improve the content that you see and hear in this webinar series. So please take a few moments to address the question. I understand steps that my agency, school, and program can take in order to integrate relationship education into our services. I'll give you a few minutes to vote. All right, we have one more question. We can move on to the second question. This is, I understand ways to overcome challenges and barriers to integration of relationship education into my agency's service delivery. Okay, we'll hold this question up for about 5 more seconds just to give everybody time to register their vote. All right, we'll move on. Now that we've seen some background information and discussions around implementation, challenges to integration, and opportunities for collaboration and partnership, I'd like to turn it back over to Robin, who will highlight tools and projects available through the Resource Center to support your integration efforts.
Thanks, John. So here we are, back with me again to talk more about the National Resource Center for Healthy Marriage and Families. And as you can see here, this is our website, and this is what it looks like when you go to the home page. Very easy to navigate. We think it's very user-friendly, almost a toolkit design, not to be designed to be too text-heavy, but make it easy for you to find the information that you're looking for. When you go to the website, if you look under Success Stories, you'll see Utah has also had luck integrating relationship education skills into its school system. They use an adult roles and responsibility curriculum. So there's a lot of good information out here. Again, as I mentioned, it's very toolkit, very user-friendly. As you see here, we've got things broken out by various topics, children and youth services. You'll find information under each of these topics, as well as a lot of information if you go into the library. I know that we talked about the different levels of integration. We highlighted Gilbert in Texas, and we know that Texas is one of the rock stars in this work. And everybody isn't going to start exactly where Gilbert is after he mentioned they started in 2004 with this project. So we think about the levels of integration as opportunities for folks to kind of start where they are and find ways to integrate. And what the Resource Center does is provides you all of those different tools that you need in order to do that. So, for example, if you were to go into the library and look for documents related to youth, over 30 documents would pop up, one of which would be the P.A.P.A curriculum case study. These tools can be used to help you learn what others have been doing so that you can take and implement some of this. In thinking about those various levels, we also have basic fact sheets on child support, as Gilbert talked about the importance of raising awareness of the rights and responsibilities associated with paternity establishment and parenting in general. This information might be helpful in terms of handouts to share with the families that you serve, the youth that you serve, and your colleagues to raise their awareness. We also heard Gilbert talk about partnerships with family and consumer science. One of the things that the Resource Center can do is help you in terms of developing partnerships. We can connect you with family and consumer science folks who are connected to the Cooperative Extension System. We have a partnership with them and can help you identify those folks within your own states. We can also help connect you with healthy marriage grantees who might be working in your state. There are several in the state of Texas that are doing a lot of good work. That would be level 2, as we talked about earlier. Level 2 would be developing partnerships for referrals. We have tools on the website to help you identify appropriate partners and then define what kind of structure that partnership might need to take in order to make sense. There are also some sample MOUs and other tools in order to help you manage that partnership effectively. We also, when you think about level 3, which is where the P.A.P.A curriculum is, P.A.P.A curriculum is a curriculum that is available, as Gilbert mentioned, but we are also at the Resource Center working on a guide that will help you identify, I think there's approximately 31 curriculum that are free or low cost, under $300, that you and your agency could actually integrate if integration is what you think you'd like to do. All of that is available through the Resource Center. As I mentioned, the Resource Center offers the website you just saw, a searchable library, stakeholder-specific products. Many products that are still in development are very specific to different stakeholder populations. We wanted to make sure we were speaking your language and help you understand how relationship education skills can support the families that you serve and move them towards the goals of your agency. We are also working on our virtual learning center, which will go live after October, and there's additional training and technical assistance that's available that you will hear Ted talk about. So when you think about the Resource Center, there's a lot of expertise that goes behind the Resource Center. We've heard today from John, from Ted, and from Deborah and myself, but that expertise covers a wide range of things: research, program design, organizational development, all of these different areas, and on a variety of topics, everything from healthy marriage to family strengthening to family safety, child welfare, workforce development, and so forth. So I said that so that you would know that there is a tremendous amount of expertise behind the Resource Center. And in addition to those who are part of the staff, we also have a cadre of experts around the country that we can tap into for additional support for specific issues that we might need. So with that, we are going to transition into another survey question. and then back to Ted, who's going to talk more about the training and technical assistance. So on this survey question, I now know more about resources available from the National Resource Center and how these can assist in integration of relationship education into my agency service delivery. So with that, if you'll take the next 30 seconds and vote. And again, we will have a question and answer period after Ted's presentation on training and technical assistance, so that I do hope that you'll hang around and give us an opportunity to answer some of those questions. All right, with that, I'm going to turn it over to Ted and say thank you once again to our special guest, Gilbert.
Thank you, Robin. Wonderful. So as we start to bring this to a close, and just a reminder, there will be Q&A here shortly as well. So Andrea will walk us through the steps of how to post your question here shortly. But you might find after this webinar that you have questions that come up as you review the materials and start thinking about integrating healthy marriage relationship education into your services, and think, wow, I'd love to get some more help, and we'd love to hear from you. The National Resource Center is here to provide you with training technical assistance, and to do so you can visit the website and put in those requests. And the very last slide that we'll provide at the very end will provide the website and the email address where you can request that technical assistance. But in the upcoming year, we'll be offering several webinars that will be very topic specific and relevant to understanding how to work with youth, for example, the latest research that might be coming out that might be of use and relevance to what you need, as well as webinars that feature products and resources that are coming out from the National Resource Center and how to use those resources. So there'll be a variety of webinars to look for. And the best way to know when and what's being available through webinars is to sign up for the National Resource Center listserv, and you can do that on our website. As well, we'll be offering online training opportunities. We'll have a virtual training center, as Robin mentioned, and we'll have modules that you can, you or your staff or your colleagues could watch at your own pace and go through. We will also be doing a series of regional and or state Integration Institute trainings. In fact, we are launching our first 3 Integration Institutes trainings this September in North Carolina, Missouri, and Arizona, where we are trying to bring together stakeholders and agencies trying to address and integrate healthy marriage and relationship education to those services, and working with those partners to find ways to do so. And so if that's something that might be of interest to you, again, contact us, and so we can start the discussion and conversation and hopefully move things forward to bringing this training to your state. As well, we will be providing individualized technical assistance throughout the year. So as questions arise, whether it be with regards to choosing the right curriculum, finding someone to provide a training, best practices, promising practices, and effective strategies for engaging clients and building partnerships and resources needed, contact us and ask, and we will either be able to provide you the answer, or we will certainly point you in the right direction where you can get the answer. So we look forward to working with you and your community and your partners to integrate healthy marriage relationship education, and please don't hesitate to contact us for technical assistance support. So with that, I'd like to highlight or move to a couple more poll questions. Again, these poll questions are a means to help us understand what your initial thoughts are with this webinar, so future webinars we can continuously enhance them. So with this, are you likely to talk with others at your organization about the integration of relationship education into your current services or role at work? We have yes, possibly, not sure, or no. So already many of you have already responded. Let's take about 5 more seconds. If you could quickly post your vote on there, and we'll move to the next one here shortly. All right, next question, please. Are you likely to use the National Resource Center for resources or training technical assistance in the future? Again, let's take about 10 seconds here and quickly put your response, yes, possibly, not sure, or no. All right. And with that, I'm going to turn it over to Andrea, who is going to walk us through the question and answer.
Thanks, Ted, and thank you so much, everyone, for your presentations today. At this time, we'd like to transition to our question and answer period, and please stay tuned for a final survey question afterwards as well. So we've had a few great questions submitted so far during the presentations, and I'm going to be posing them to the presenters over the next few minutes. I'd like to invite everyone to please feel free to continue to submit questions, though, during our question and answer period. And again, you can do that by using the question and answer function on your screen. So our first question is for Gilbert, and the question is, do any organizations other than schools use the P.A.P.A curriculum, and how much does it cost?
That's a really good question. As I said, when we started this out in 2004, we primarily did it through family consumer science classes, but we also have a number of community-based organizations which use the P.A.P.A curriculum, Head Start organizations, nonprofit organizations working in community. All of those we train and provide the curriculum to, and we do that for any agency. We have a requirement of having at least 15 attendants to really make it worth our while within the state of Texas. Unfortunately, jokes don't work too well over webinars, but we don't actually travel out of state to provide that training, but it is we will work with other state agencies to make sure that the legal information is up to date for whatever state you're interested in. You can always review our P.A.P.A curriculum, and we can send that to anybody who wants to see a review copy. Again, it's going to be specific legal information from the state of Texas, so it may not transfer well to other state child support laws.
Okay, great. And we have a couple follow-up questions for you as well. One of the first ones is, so who are the trainers that you're using to teach the curriculum?
Well, I actually, it's a train-the-trainer model. So I have a group of 3 P.A.P.A trainers who go out and provide this training to the health teachers primarily. Through a 6-hour training that when they leave, they have the curriculum, they have all the resources that we have available to them, and they then go out and as a part of their health day, when they're teaching their health class, they would integrate the P.A.P.A curriculum into their normal health studies. Multiple classrooms use it. Like I said, family consumer science and life schools classes continue to use the P.A.P.A curriculum, but they are primarily done through teachers or nonprofit organizations and facilitators who have gone through our required P.A.P.A training.
Okay, great. And then a question we have is, does the P.A.P.A curriculum serve teens in same-sex relationships?
It's kind of silent in that. I mean, we talk about healthy relationships. We talk about marriage, but of course within the state of Texas, that is specific to male-female relationships. So it's pretty much silent in the issue. It doesn't bring it up one way or the other.
Okay, and then another follow-up question is, how in the beginning did you decide to use the P.A.P.A curriculum instead of using another curriculum that's out there?
I mean, it's obviously quite selfish, but I mean, we honestly see it as a child support curriculum. So making sure that we do outreach and education in regards to young people's knowledge and attitudes regarding the legal issues of becoming a parent in the state of Texas. And so it serves our purpose. And we did look at other curriculums, and there's a lot of good relationship curriculums out there. We hired healthy relationship curriculum writers to help us design it, and so we just felt that if we're wanting to provide this curriculum to everyone who wants it in the state of Texas, it had better be our own, and we were able to, make sure that our information was included in a way that we wanted represented. That really kind of is the genesis of what's in the curriculum and kind of how it serves as a child support outreach and education program prior to any problems arising for child support or young families.
Okay, great. And then our next question is for Robin, and the question is just about wanting more information about how the Resource Center can help provide assistance or resources for choosing our curriculum.
Well, one way would be to visit the Resource Center website and to see what's already out there. Another would be to send us an email to the Resource Center and let us know specifically what you're interested in, and then we can kind of chase it down and get back to you. Or there is a TA request, training and technical assistance request form on the Resource Center website. If you have some specific ideas, filling out the TA request form is probably the easiest way to make that happen.
Okay, great. We have a couple more questions here, and so the next one, Gilbert, is for you again, and it's just somebody wanting to have a general idea of what other states have adopted P.A.P.A or are thinking about it.
There's different levels of integration or adoption of the P.A.P.A curriculum. I know New York is looking at it, but it's pretty much citywide. Minnesota, Washington State. I have a list of about 10. I mean, it kind of varies depending on what stage they are in adopting the curriculum or revising the curriculum. But if somebody wants specific information about a state, I'd be glad to share contact with who may be in charge of doing that within any specific state.
Okay, great. And then we just got another question about the P.A.P.A curriculum. Somebody is asking if it's an evidence-based curriculum.
Well, there's different levels of evidence-based, research-based type curriculum. This has not been rigorously evaluated, so I would want to say that in people's description of using evidence-based curriculum, but it has been evaluated by the LBJ School of Public Policy. We've seen significant increases in knowledge and attitudes in regards to students' attitudes about parenting, when they want to become a parent, child support laws, child support guidelines, policies, things like that. And so we do have quite a bit of evidence that it is that students participating in the curriculum are definitely getting something out of it. But oftentimes when we talk about evidence-based, we're using it as a definition of talking about rigorously evaluated curriculums, and that has not been, P.A.P.A has not been rigorously evaluated in the terms of being evidence-based curriculum.
Okay, great. Thank you. And then our next question is for Robin, okay. And it asks if the Resource Center has handouts that can be used and distributed by programs.
Yes, absolutely. There are quite a number of handouts, and they're topic specific, so if you just go into the searchable library and indicate the topic that you're interested in, you should be able to find some of those handouts. Some of the handouts, for example, one that comes to mind is the importance of trust in relationships or commitment in relationships. There are also a series of fact sheets related to child support that are in there. The other thing that I would mention about resources that are available through the Resource Center website is that we really didn't try to reinvent the wheel. So if there are other resources on other sites that we think would be appropriate for our stakeholders, we have linked to those. So there are a lot of good tools and resources that you can get to through our Resource Center that don't necessarily live on our Resource Center.
Okay, wonderful. And then it looks like our final question for today is about is asking if we are familiar with Cooperative Extension's NERMIN program at USDA. So Ted, maybe you could speak to that for a minute.
Yes, the Cooperative Extension, for those on the call who might not be familiar, each state has a land-grant university system that, in Georgia, for example, the University of Georgia. In Texas, that would be, I believe that's Texas, and Texas Tech might be there in Texas. Gilbert, correct me if I'm wrong. I believe
It's my alma mater,
Texas, right?
Yes.
Yeah.
Texas A&M, yes.
Yes, Texas A&M. So, and each land-grant university provides outreach through, it might be a College of Ag, could be a College of Family Consumer Science or equivalent, but they provide support with 4-H programming, which is programs working with youth, promote positive youth development, as well as family consumer science education, where parenting education is offered, financial education, nutrition, as well as relationship education. And each state varies in terms of the type of program and resource available within that state. Nationally, there is a network known as the National Extension Relationship and Marriage Education Network, which includes specialists such as myself that work in extension, that specialize in relationship and marriage education, and provide and work together to develop resources and educational tools that can be shared. And many of those resources are highlighted and featured on the National Resource Center for Healthy Marriage and Families website.
Okay, great, thank you. And then we've also had questions about people wanting to know more about the Integration Institute, the events that are going to be held in Arizona, North Carolina, and Missouri. And then we've also had people asking about getting a copy of this PowerPoint from today's presentation. So I just want to take the opportunity to remind everybody that all of that information will be available on our website. This presentation, a transcript, and a question-answer document will be posted to the website, as well as ways to get in touch with us about upcoming events and to look at the resources that Ted and Robin have mentioned and request assistance in different ways. So we are going to have one final survey question, and then we will post that information on how you can get in touch with us. So please stay tuned for a few more moments, and then we'll have that information for you. So our final question today is, please rate your overall satisfaction with today's webinar. And we're going to take just a few moments to do this, and again, all responses are anonymous. And if you're sitting with a couple people, then just take the general consensus in the room. But we appreciate your feedback because your answers to these questions help us continue to develop our resources and webinars. So we have a couple people answering. We'll take a couple more seconds here. All right, and then here is our contact information, and I'd like to thank everyone for joining. Have a great afternoon.
This concludes today's conference. Thank you for your participation. You may now disconnect.